Good morning, guys. I hope we're all sparkly. Today we're going to talk about my favorite topic, bums. No boobs, no sex. What do you need to attain to have a fighting chance of having sex? Hopefully a partner. But no, what you need is a stonker. So we're going to talk about bonkers to stonkers. I'm not trivializing mental health or mental illness when I'm saying bonkers, but hopefully by the end of this video, you'll appreciate why we're talking about this as well as this. Erections are complex neurovascular mechanisms under hormonal control. When you were 16, sitting on a train, ooh, what's this? Yeah, it was very easy to attain an erection. When you're in your 40s and 50s, when the weight of the world is on your shoulders, when your past is catching up with you, the invincibility of youth, oops, shouldn't have done that. Yeah, it's a little bit difficult. So obviously the focus of our attention here at the Men's Health Clinic is normalizing your melandrin levels. One of the symptoms of low testosterone is low libido and an element of erectile dysfunction. They are kind of interrelated. Not kind of, they are interrelated. This influences this, and this influences this. We talk about physiology being more important than psychology. Psychology is also obviously important because it influences what? Our physiology. So the premise behind TRT is normalizing your melandrin levels to help facilitate growth and repair. Normalizing physiology. You are designed to fight and you are designed to fornicate. And we all like a bit of fornication. So one of the things that you need to have is a healthy male androgen profile. What's the best way of doing that? Microdosing. Testosterone, cypionate and HCG. Why not just testosterone? Because HCG keeps the testicles working to help normalize physiology and helps keep this working. So there is upregulation of the neuroendocrine system through the use of HCG. One of the potential problems from testosterone monotherapy is not only just tiny testicles, it's also this not working quite as well as it should do. LH is located in the brain. Testosterone monotherapy suppresses LH. Can you be horny goat boy with testosterone monotherapy? Yes. But what I would say to you is make sure you check your pregnenolone, progesterone and DHEA levels. Because the reason why we use HCG is it's to replace LH. It's because we like the concept of HRT, not TRT. So this ratio is important. What's the primary influencing factor? It's SHBG, my favorite glycoprotein. Yeah, pretty sad. But a healthy SHBG level will lead to a healthy testosterone to estrogen to DHT ratio. High SHBG will lead to a dysregulation of this. Low SHBG will cause a dysregulation of this. Now we know that DHT has a higher affinity for SHBG than testosterone than estradiol. So you can kind of work out what the problems are going to be with high SHBG and low SHBG, which is why we want to be right in the middle and actually have a high normal SHBG, because high SHBG confers a health benefit. Remember what SHBG does. It acts as a buffer. It also helps the transfer of testosterone into the cell to help facilitate this thing. What is it? Growth and repair. Repair from the day to prepare for tomorrow. So a good ratio of DHT to testosterone to estradiol is incredibly important for erections. Now let's extend this a little bit further to the old noggin. Now we've said before, DHT, aggression. Testosterone, drive and determination. Estrogen, empathy and insight and understanding. That's why women would make good leaders, but us aggressive men force them out. If you can't keep up, they would make good leaders because they are more empathetic and understanding and better versed at communicating. But we get in the way. More for you. So for a healthy libido, you need the right ratio of all of these three hormones. But let's extend this a little bit further. Progesterone is influenced by 5-alpha reductase, which cascades down to eventually cause GABA. GABA influences stress, and guess what that influences? Libido. When is your libido at its highest? When you're stressed? No, it's when you're chilled. When should you be thinking about intercourse? When you're chilled. If you are supposed to be fight or flight, surviving, protecting, hunting, gathering, are you supposed to be horny goat boy? The answer to that question is obviously no. If Raquel Welch is there in a leather-clad bikini, distracting you from this tiger coming behind you, you ain't going to last very long. So sympathetic, catabolic, you're not supposed to be horny goat boy. You are supposed to have a high libido when it's safe, when it's time to relax. Which is why when the parasympathetic nervous system is initiated and the social engagement part of the autonomic nervous system is working, it's time for fun. But if you are stressed and anxious and constantly in fight or flight and cortisol is flying around your body, you don't stand much chance of having a healthy libido. So what can you do to directly influence your libido? Or more importantly, your parasympathetic nervous system? You can eat. It's why they call it comfort eating. But it's not a really good idea to have a full belly when you're about to have a bit of nookie. What else can you do? You can breathe. Hopefully you're breathing anyway. But if you control your breathing through breath work, you can stimulate the parasympathetic nervous system. That is fascinating. That is something that we do not fully appreciate, but it can directly impact your stress levels. Breath work. It's nice, isn't it? Conscious breathing. Conscious, controlled breathing. It's calming. When you're calm, you can use this to so do it. So, as I said before, erections are complex neurovascular mechanisms under hormonal control. You can go even deeper and talk about the influence of testosterone and estrogen on dopamine and serotonin. Dopamine pleasure, serotonin happiness. That interrelationship is incredibly complex. Too much, too little. Our lives should be incredibly simple, but we complicate them by dysregulating our physiology. interfering, manipulating our physiology because we think we're clever. We're not clever. Base animals have a more satisfying life than our higher state of consciousness. It's been distorted terribly. It needs to stop. Go back to basics. So you've addressed your hormones, you've addressed your nervous system. Let's address your vascular system. We are fans of daily tadalafil, 5 milligrams. It's a PDE5 inhibitor, and it helps the release of nitric oxide, which causes vasodilation. And vasodilation causes a stonker. Does that influence libido? Because it's a physical thing. Well, actually it does, obviously. If you get a little tingle, brain's going to go, oh, I've got a little tingle. So it's going to say, right, okay, let's get ready to rumble. So tadalafil can actually have a positive impact, not only on your erection quality, but also your libido. And then you're ready. Isn't it amazing? Isn't it fascinating? The interrelationship between physiology and psychology and physiology. The complexity within the human body is immense and incredible. If you interfere with something, it knocks on and interferes with something else, and you have a cascade effect. Much like all hormones are dependent, not independent, whether that relationship be direct or indirect, that can be extended into absolutely every aspect of our bodies and our lives. If you're negative, you'll be negative. If you're positive, you will be positive. You are a product of this. Whilst this is important, this is way more important. Keep it simple, keep it safe, look after yourselves.